Bismillah Rahman Rahim. I'm Zahur Islam and you are watching my lecture on YouTube. So let's take a start. Today the topic which I am going to present, that is the drugs used in the treatment of diabetes mellitus. So before starting lecture on the drugs acting on endocrine disorders, first of all you should know about diabetes mellitus. So you know that diabetes mellitus is autoimmune disorders, or this is a metabolic disorders in which the pancreas failed to produce insulin and the level of sugar become rises and the person become diabetic. Come toward the classification of diabetes. Diabetes can be classified into two categories. The first one is type 1 diabetes mellitus, while the second one is type 2 diabetes mellitus. Type 1 diabetes mellitus is also called insulin dependent diabetes mellitus, while type 2 diabetes mellitus is called non-insulin dependent diabetes mellitus. And another one is diabetes due to secondary causes, while the fourth one is called gestational diabetes, diabetes which is occur during pregnancy. This is very easy to understand. Let's see on my screen. There are 6 major classes of anti-diabetic agents. So the first one is, these are the class of oral anti-diabetic medication. This is the mechanism to control the glucose level, and this one is generic name and this one is brand name. So first of all, you will have to memorize the 6 classes of anti-diabetic drugs. So the first one is sulfonylureas, the second one is meglitinides, then biconides, and then thiazolidinediones, and then DPP4 inhibitors, and the last one is alpha glucosidase inhibitor. So sulfonylureas, its simple mechanism of action or mode of action, so it can improve the insulin production. There are certain complications at the level of pancreas. As we know that in pancreas there are basically 3 types of cells. One is alpha cell, and then beta, and then delta or gamma cells. So you know that alpha cells release glucagons, while the beta cell release insulin, and the delta cells release somatostatins. Sulfonylurea, it is one of the major class of oral anti-diabetic medication which can improve the insulin production. Sulfonylurea, it is available in a market by a trade name diabetes, micronase, glycinase, dibeta, glycron, amarylase, glucotrol, and glucotrol XL. So sulfonylurea, it is available in a market by different names. Look at this, is the generic name of sulfonylurea, that is chloropropamide. The second one is glyburide, and then glimepiride, and then glipizide. The second one is meglitinide. So meglitinide, it can also improve the insulin production. Its generic name is ripaglinides and nitiglinides. So if you remember in our previous lecture that we have discussed about different antibiotics, that for example ciprofloxacin belong to fluoroquinolone. So the same case is here, that meglitinide, actually the ripaglinide, this is the generic name of the oral anti-diabetic medication, and its main class is meglitinide. They are available in a market by trade name Prendine and Starlex. The third one is biguanides. The mechanism of action or mode of action of biguanides, it can reduce the hepatic glucose output and increase the uptake of glucose by the periphery, including the skeletal muscles. So we know that if biguanides is administered to the diabetic patient, so it will directly reduce the hepatic glucose output and it can increase the uptake of glucose by the periphery, including the skeletal muscles, like metformin and glucopage. So this drug biguanide is available in a market by trade name glucopage and its generic name is metformin. The fourth one is thiazolidinediones. This is another class of oral anti-diabetic medications which substantially attenuate the insulin resistance. Our main target is to produce sufficient quantity of insulin in order to maintain the glucose concentration in the blood. So thiazolidinediones is available in a market by different names, that is Avendia and Actus. By its generic name is rosiglitazones and pioglitazones. So I mean that thiazolidinediones, it is actually available by a trade name Actus and glitazone. Another one is DPP-4 inhibitor. Dipeptidides or DPP-4 inhibitor, it causes the inhibition of DPP-4 enzyme, which prolongs and enhances the activity of incretin that play an important role in insulin secretion and blood glucose and control the regulation. So DPP-4 inhibitor include sitagliptins. You know sitagliptin, this is the generic name of DPP-4 inhibitor and it is available by a trade name Genovia. So the DPP-4 inhibitor, they are responsible for, or it cause inhibition of the DPP-4 enzyme, so it can prolong and enhance the activity of incretins. And you know better about the role of incretin, which plays significant role in insulin secretion and blood glucose control regulation. So DPP-4 inhibitors actually they are dipeptidyl peptidase 4 inhibitors. So it is the name of the enzyme. Actually it can inhibit the DP4 enzyme activity in order to prolong and enhance the activity of incretins, which also play a very important role in insulin secretion in the blood glucose control regulation. Because our main target is, after administration of DPP-4 inhibitor, dipeptidyl peptidase 4 inhibitor, that it can reduce or it can maintain the blood glucose concentration. The sixth one is alpha glucosidase inhibitor. This is another class of oral anti-diabetic medications which can slow the digestion of the starch polysaccharide in the small intestine. Its generic name is acarbose and miglitol. So they are available by different names like Pericose and glycate. So these are the 6 different classes, very important classes. So most of the physician prescribed or recommended these 6 class of drugs, but it depends upon on the condition of the patient. So inshallah, in my next lecture we will just discuss about the all the classes and its route of administration and its therapeutic action and its drugs, etc. Thank you so much for watching my lectures. So inshallah I will try my best to deliver something about the anti-diabetic drugs. Wish you all the best, and if you have any question regarding my present lecture, so I'm available for any kind of services. Wish you best of luck. Thank you so much for watching my lectures. Thank you.